We want to do a little rejuvenation around the eyes, but we don't want to overfill any area so it doesn't look exaggerated or unnatural. So one of the things she's complaining about is kind of like feeling a little tired under the eyes, and what happens is this fat pad sort of like kind of goes down like this, creates a little bit of a full and full here. So what we're trying to do is do something like this, where it raises this area up like that, refreshes the eye area. But if we put all the filler in this area, then she's going to create a big cheek when she smiles. This is going to go up too high and create a big bulging cheek, which is very abnormal looking, and you've seen many people walking around like that. So we're going to put just a tiny bit there, but the most that I want to do is back here. She has a good cheekbone, very good fill, everything has good volume in here, but when she smiles big here, this corner, in here, and a little bit in here, is dropping down a little bit. So if we can put a little bit here, don't smile, then this will pick up this area. It's about lifting the tissues and replacing them in the area more natural to her. So that will create, and I'll give her a little bit in the corner to keep the eyes from getting the growthy area too. So it'll be a small amounts, but divided up in several areas so that it can maintain the balance and the beauty of the whole face, if not overdoing one face. Okay. Then the other part that we're looking at is the lower area. And what I'm doing here is showing how the skin is nice and full here with fat underneath here. She has enough fat here. But what happens, we have a ligament right here. And this is where the muscles and everything move, so you create more of a sunken space here, and this is losing a little bit of volume. She has good volume everywhere else, so but we'll put just a tiny layer, almost a spackle layer of material to sort of like keep the jowling from ever happening, and that will maintain the support of her chin, give her a little more balance on the chin, and that will balance off her lips, which are very full. So what I'm looking to do now is not to change her structure or architecture of their face or widening the chin or projecting it more. Not at all. She has great projection, good angle line. What she's missing is a little bit of the soft tissue. So the padding, it's like fluffing the pillow a little, just a little bit. So where she's missing is right here, and this area is right here. She's missing a little bit, and so it's kind of coming in with a little spackle and getting that to be a little more even, because as we age, this is going to happen, and it's going to go in and create that crease right here. As this ages, this is going to come forward and create that fold right there, and this is going to get emptier, and it's going to become more like crease like that. So we're going to give it like a little layer of support, basically, of the whole tissue. So the way I'm going to begin, big smile, show me.